Hello, I am Laura Bonanno, and I am representing the AANA Foundation Abstract Task Force. I will be presenting the submission and review process for case study or innovation projects, which are non-research. The AANA Foundation Task Force is charged with monitoring the abstract process and adapting it to make improvements. The task force evaluates the current poster abstract process and identifies gaps in the application process, the criteria for each category of abstract, and the guidance that's provided to abstract reviewers. The task force implements suggested changes to the abstract process and creates educational videos for applicants and reviewers. Updates to the poster abstract submission process starting in 2026 include a revised word count. The word count is now 325 total words, which is significantly shorter. The structure was improved with the following headings: purpose and question, methods, results, and implications in conclusion. The reference style was changed from APA to AMA. And oral or podium research abstracts that include findings and are presented at annual Congress can now be published in the AANA Journal. There are three major categories of abstracts. The first is a research abstract, which includes both qualitative and quantitative. The next two are both non-research. The first is evidence-based practice and quality improvement, and the second is case study and innovation. In this presentation, I will be reviewing the abstract submission and review process for case study and innovation projects. Prior to submission of the abstract, you will be asked qualifying questions to ensure that you are submitting the correct type of project. A case report describes an unusual, complicated, or novel case and includes the symptoms, signs, diagnosis, treatment, and follow-up of an individual patient and includes the relevant literature on the topic. The qualifying question is, does your submission describe the case of an individual patient? If yes, you will continue in the case report section. If not, you would be asked to choose a different category. An innovation project describes a new invention of a product or process that demonstrates adherence to scholarly standards and practices with proof of concept backed by evidence from the literature, which may include pilot studies. The qualifying question here is, does your innovation project reflect an innovative product or process? If yes, you will continue in this category. If no, you would choose a different category. This is the format for case study or innovation abstracts. Here there are three sections. The first section is the purpose or question with a 45-word limit. Here you'll describe the purpose of the case study or innovation and any relevant questions and address that clearly and concisely. The second section is the method section with a 210-word count limit. In this section you will describe the relevant patient history or the characteristics of the innovation, the intervention or clinical approach, and how the innovation was utilized, and also describe any analyses conducted. The final section is the implications and conclusions section with a 70-word count limit. In this section, you will describe the outcomes of the case or innovation, presenting any evidence-based plan of care, and articulating conclusions and significance for practice, and be sure to minimize overgeneralization. The overall word limit for the abstract is 325 words. Now we will review the rubric that reviewers will use to score each abstract. If you look at the rubric moving left to right, you will see that the rubric is divided into sections. Each section has a column that indicates the allotted character or word count. The next column explains the criteria. And in the last three columns, the reviewer would indicate yes, which would score 1 point if the criteria was met, or no, which would score 0 points if the criteria was not met. If the criteria was not met and the reviewer gives the score of 0, then the reviewer is required to include a comment. The first section is the overall evaluation of the abstract. So the criteria is the abstract worthy of acceptance? If the reviewer indicates no, and there is a critical flaw or weakness that precludes the abstract from being accepted, the reviewer would have to make a note and explain. The reviewer would still score the remainder of the abstract. And please remember that a literature review only will not be accepted. The next section of the scoring rubric for case study and innovation projects is the purpose or question. Here there is a 45 word count limit, or 290 characters, and the criteria are as follows. Does the title reflect the project? Is the focus of the case or innovation clearly described? Is the relevant epidemiology presented for case studies, or is the problem and aim of the innovation described for innovation projects? And the last criteria are unique features of the case or innovation included. The reviewer would again score each criteria, with yes being 1 point and no being 0 points. The next section is methods and results. This section has a 210 word count limit, and the criteria are as follows. Has appropriate approval been obtained, such as a facility approval or IRB determination, and is a statement included? Please note that this is provided separately in the submission process outside of the abstract text, but the reviewer will score that here and indicate yes if it's included or no if it's not included. The next criteria is relevant patient history provided for a case study, or is the innovation described for an innovation project? Are research ethics adequately addressed? Is the peri-anesthesia or analgesia course described for a case study, or is the innovation utilized described for an innovation project? And the last criteria is data analysis and or an evaluation plan described for an innovation project? Final section is implications and conclusion. Here there is a 70 word count limit, or 400 characters. The criteria include the following. Is a detailed description of the outcomes of the case or innovation provided? Are detailed and appropriate conclusions for the case study or innovation discussed? Is an evidence-based plan of care described for a case study? Or does the literature support the innovation design and implementation for an innovation project? And finally, are implications and recommendations for clinical practice and or the anesthesia profession discussed? The final section of the scoring rubric is writing style and format, and the criteria are as follows. Are the guidelines followed? Is correct AMA format used? Is correct grammar, punctuation, and sentence structure used? And is the abstract logical and well organized? Here are some tips and tricks for case reports. There are some important key elements to include in a case report abstract. First, the patient's medical and surgical history as relevant, a description of the peri-anesthesia course, the literature review and current recommendations from the literature. The conclusion section should address why you think the patient outcome occurred and whether current treatment recommendations might have produced a different outcome. And finally, you should include implications for clinical practice. And now we'll talk about some tips and tricks for non-research abstracts. The reviewer rubrics evaluate each section of the abstract. So remember, if the template is not followed and a section is missed, the reviewers may give a 0 for that section, which will discredit what could be an overall good project. The limits for word and character counts are hard stops. If your abstract is over the character or word limit, you will not be able to submit, which could result in an incomplete submission or the need for you to scramble to shorten it at the last minute. It is important to describe what you did and why your project matters in a clear manner. And now some tips for the reviewers. Remember to review each abstract thoroughly. Provide comments to justify any no responses. And overall, consider the following. Is the question clearly stated and important? Is the method appropriate and well described? Are the results presented and supported by the data? Are the conclusions supported by the data and appropriately limited? Is the abstract written in a clear and concise manner? And overall, is the topic of the abstract a good fit for the meeting? On behalf of the AANA Foundation, I wish to extend our sincere appreciation for your time, expertise, and commitment to ensuring excellence in scholarship.